Hello.
Hi, Tom.
So Dr. Lil Breen is a general and community paediatrician who always considers the biopsychosocial management of her patients. Thank you for agreeing to talk to us about our training principle of the month. How can biopsychosocial approach be applied at all times?
So much of our paediatric practice is influenced by psychological and social aspects of children's lives. If we neglect these, it is very difficult to provide patients with a good level of care. Many of the young patients, the young people that we see, have very complex, challenging lives. And if not objectively difficult, the children themselves quite often perceive lots of challenges. Some children have huge hurdles to navigate in their day-to-day lives. As a paediatrician in any field, it is really important that we take these factors into account when we're providing their care. With each patient you review, you think of what is going on in this family, what are the factors that may be contributing to this child's difficulties. Consider how will this diagnosis affect the young person's experience of school and their social life and their emotional well-being. Ask yourself, how as a team can we engage with and support this young person and their family on their journey, really, with those challenges.
Okay, thank you. To enable paediatricians of the future to engage with, assess and manage those that they care for, they need to be equipped with the appropriate tools and knowledge. How can trainees develop strategies for supporting psychosocial aspects of patient care?
I guess the first part of this is to think about it and to discuss it with your patients and with other members of the MDT. It's just keeping that awareness of it. It can be quite helpful to examine illness through the lens of predisposing, precipitating and perpetuating factors. Tools such as HEADS can be very helpful in helping us to think about these factors. So that involves asking questions about home life, education, activities, drugs and alcohol, suicidal thoughts and sexual activities. In many situations, asking about these things will have a bigger impact on our patient management than asking about allergies and birth history, things that we're very accustomed to asking about. Yet we don't often ask these more detailed questions. When these questions become part of our normal patient encounters, it becomes much easier to ask them.
Mental health problems in children and young people are increasing at an alarming rate. How can we engage with and support those struggling with their mental health?
Well, mental health services are stretched beyond capacity. Most of current resources are focused on high-risk management of high-risk patients. If we support our patients earlier on in their journey, we can sometimes help prevent some of the deteriorating mental health. Sometimes simple recommendations can help. We can encourage increased physical activity, healthier eating habits, attending local youth groups, and avoiding harmful social media content. Things like that can be helpful. It is good for us to have an awareness of a few local resources that might be helpful. We could suggest these to the young people who are struggling with their mental health. We should all have some go-to apps, websites and links that we can recommend. As a trainee, I think it would be really helpful if we could access have some opportunities to spend some time with CAMHS practitioners, including psychologists and psychiatrists. This can help give us an insight into how they can assess and manage patients, but also how they can sometimes deal with some tricky questions.
Okay, thank you. And how can trainees learn to help prepare our patients for transition?
Okay, this is a very pertinent one. This is the move from children's services to adult services. It can come as a big shock to young people and their families if they're not prepared for it, if it's not discussed beforehand. It can be difficult to adapt to the way services are delivered. The different resources are available, and there's very much a focus shifting towards individual autonomy for young adults, really. It's important to bear this in mind in all our clinical encounters with teenagers. Having an awareness of what's available in adult services is crucial. In some specialities, it is really helpful to have joint transition clinics with colleagues from the relevant adult field. This isn't possible for every young person, so it may also be useful for you as paediatricians, or for us as paediatricians, to attend some adult speciality clinics to see how they work, and to see how services are delivered. We can then use this information to help prepare our patients for that transition. Some young people wouldn't automatically transition to adult secondary services, so again, it's really important to encourage good communication between patients and primary care services in their teen years.
That's really helpful. Thank you very much, Lil, for your insights today.
You're welcome, Tom. Thanks.